The situation before DHIS2 was quite primitive. DHIS2 has helped us institutionalize the data collection, data analysis, and hopefully the data use at all levels. I'm Dr. Kediende Chong from South Sudan. I work for the Ministry of Health, the Director General for Preventive Health Services and Emergency Response. The Ministry of Health South Sudan uses a DHIS2 as the national reporting platform for the health sector. It's allowing us to get timely and accurate data compared to the previous period. The reporting generally has improved. It's allowing us to reach down to the people, to the frontline workers, train them, make sure that they are given the necessary skills to provide the data. DHIS2 has helped us. South Sudan managed to use the DHIS tracker for LLIN distribution. Not many countries have done that. And in the context of South Sudan, at the beginning when we planned and we made the decision for this, it wasn't easily believed by many people that South Sudan could do it. But good enough, we were able to do the distribution of the LLINs. We reported that digitally. And the distribution has actually, for the first time, covered the whole country in a few months, in less than a year. Previously, we used to do it as a kind of a rolling campaign over a 3-year cycle that the Global Fund gives money. But this time around, the actual distribution took less than 6 to 8 months. We were able to also do the registration of the households digitally, and that made us to have reliable data across the country, at least 8 out of the 10 states. The nets that are being distributed at the family level from, of course, the house-to-house distribution. And we were able to get the geo-coordinates of the households, and that actually helped us for the post-campaign evaluation or verification. So within the DHIS2, the tracker that we use, we were able also to generate a logistic form that shows the nets that are actually being moved, the nets that are being distributed, and actually reconciliation at the end for each and every local area, and to report to the donors. It has also helped us to ensure accountability and proper reporting for the nets. We are required by the donors to account for the nets that we have used or distributed. The DHIS2 has helped us to do that for the first time. We have also used it, to conduct some assessments. So we have actually used the DHIS2 to do actually an assessment of the consumption of the contraceptives and the family planning. We have been having serious flooding in some parts of the country over the last 4 or 5 years. The distribution happened when the rainy season has already started. So that has actually resulted in limited access. The last mile distribution of the nets that are actually being distributed to the distribution sites by trucks, they couldn't move. Some local bridges were actually broken, culverts were actually washed out. So we ended up using the communities. They carried the nets. So the community themselves were actually mobilized. They were able to carry the nets to where they are supposed to be distributed. We are currently piloting digitalization of the community health program. The health facilities are limited to 2,000, far less than what is required for the population of 15 million in the country, and a big country that is more than 600,000 kilometers. The last assessment that was done in 2013, the accessibility to the healthcare services was around 44%. It showed at the time 56% of the population can't access the facilities. And access is defined as to people who live within 5 kilometers radius from the nearest health facility. And that was before the conflict. When the conflict started, a good number of facilities were destroyed. With the flooding over the last 4 or 5 years, a good number of facilities have actually been washed out or totally submerged in water. So accessibility now practically must definitely be less than the 44%. So delivery of the healthcare services to the communities by the community volunteers. That one has been having a lot of challenges, using paper-based or, with the rains, with, keeping the papers for some time, handling them. So we are now piloting digitalization of the Boma Health Initiative to digitalize the community health program. The innovative idea we had was to learn from the Ethiopian Extension Workers Program, and we develop our own that we call Boma Health Initiative. Boma is the smallest administrative unit in the structures of South Sudan. This Boma Health Initiative is the one extending the services beyond the facilities. We believe it will also help and will be a game changer in the delivery of the health services. Can use it for the registration of the birth and death or the CRVs. We can also use it for all the outreaches, the immunization program, the nutrition, and so on. DHIS2 motivated us in so many aspects, and I believe it will continue to motivate us as long as it continues to solve some of our challenges.